Caucus and for to talk about one of the issues that is of the utmost importance to the American people. And I appreciate your allowing me to join you today and share what I believe to be one of the best solutions out there. I hate to call them alternatives because they're actually solutions. I think it's important that we think in terms of solutions when we think about something as important as healthcare to all Americans. I want to start with just a couple opening comments and then briefly review H.R. 3400, which is the bill that I've been asked to talk about this morning, and then look forward to the questions and concerns from folks who are listening as well as those here. The first statement that I would make is that the status quo is unacceptable in health care, and I think that's important because people have this general sense that Republicans, if they could have their druthers, if they could have their way, that nothing would happen at all. And in fact, that's not so. We appreciate, especially those of us who practice medicine for years and years and years, is that there are significant flaws in our current system and that we ought to be able to fix those. We do, however, believe that there are solutions that exist that embrace principles, that embrace fundamental principles that the American people recognize as being important in healthcare. And if I had to outline or define what those principles were, everybody's got their kind of sense of principles. But I've got 6 of them that I try to bring to the table in the area of healthcare. The first 3 are included for virtually everybody. Those are access. We need to have a system that folks have access to. Affordability. It's important to have a system that people can afford. And then quality. We want a system of the highest quality in the world. I add 3 to those, and they are innovation. We need to have a system that's innovative and is able to continue to have the greatest quality health care in the world sustained. Responsiveness. It's important to have a system that's responsive because it doesn't do you any good if you get through the front door of the doctor's office but there's nobody behind the desk to see you, so it has to be a responsive system. And then choices. The American people want choices in so many things, and certainly healthcare is one of those. So when you think about those principles, access and affordability and quality and innovation and responsiveness and choices, I would suggest that none of those principles are adhered to with the 2,000-plus page monstrosity that was voted on in the House of Representatives just 10 or 11 days ago. And that if we concentrate on those principles, we can come up with a pretty doggone good bill, and that's what 3400 is. Now, 3400 doesn't hurt your back to lift it. It's 268 pages, and you could put it in your briefcase and carry it home or wherever you need it to relatively easily. And I want to review the core solutions that we have in 3400, which I believe, actually reform the system in a positive way. First is that the whole issue of coverage. It's important that we get folks covered in the area of healthcare. People need healthcare coverage, and there are fewer individuals that need coverage than the Pelosi bill would lead you to believe. But there are folks that aren't eligible for a current plan, that aren't eligible for their parents' plan, that don't have the financial resources to be able to gain health coverage, and for whom we as a society ought to be able to provide appropriate financial encouragement or incentives to gain coverage. The purpose of 3400 is to make it so that every single American at the end of the day says, oh look, it makes more sense for us to be covered financially than not. And so we provide a series of tax deductions, tax credits, refundable tax credits, and even advanceable refundable tax credits for those folks that aren't enticed by a tax credit because they aren't paying that level of taxes, so that everybody can gain access to health coverage. And I think that's incredibly important to appreciate because we need to, as a society, move toward having more individuals covered. There are also incentives in place to allow individuals to purchase their own coverage when they're able to afford it, so that the tax treatment of health coverage is the same as for employers. And then there's insurance reform. There are real challenges in the area of many portions of our insurance industry that preclude or make it difficult for folks to gain health coverage or the two big ones clearly are pre-existing injuries and portability. Pre-existing illnesses and injuries, you ought not be priced out of the market if you have an awful diagnosis or you have an awful injury. And you ought not be thrown into an individual market that doesn't make it so that you're able to gain coverage. So what we put in place, again, are the tax incentives to be able to purchase, but also very robust pooling mechanisms through association health plans, through individual membership accounts, purchase across state lines, those kinds of things that make it so that individuals have the wherewithal, the ability to be able to gain coverage regardless of their health status. In addition to that, we put incentives in place for high-risk pools. Many states have high-risk pools, but many of them aren't adequately funded, and we put in place appropriate incentives to allow states to have a better opportunity to fund their high-risk and their reinsurance pools. The whole issue of portability, you ought to be able to, you ought not lose your insurance if you change your job or you lose your job. And the way that we address that is to provide patients the power to own and control their own health coverage, their own health insurance policy, so that they can take it with them. And we think that's one of the keys to making it so that people don't lose their health coverage when they change their job or they lose their job. Third, the whole issue of quality. We're seeing right now played out the question of whether or not certain tests ought to be required for folks for a specific diagnosis. In this instance, this week it's breast cancer, next week it'll be something else, and on and on and on. And the whole question is, who ought to be making medical decisions? We believe fundamentally that it ought to be patients and families and doctors, and that it ought not be bureaucrats, either in the insurance industry or in the government. And so we say very explicitly that medical decisions ought to be between patients and families and doctors. And the whole issue of what kind of care is recommended ought to be provided, ought to be decided by medical specialty societies, not by the Comparative Effectiveness Research Council or some other entity within the federal government. So from a quality standpoint, we believe that it's imperative that physicians and patients be the ones that are able to make, that have the right to make those decisions. In terms of healthier lifestyles, there are wonderful programs out there in the private sector right now. Safeway has one that many folks have looked to that provide and have employers offer discounts and incentives for being able to put in place appropriate wellness and prevention programs. And fourth, I say to folks, you can't be serious about health reform if you're not serious about lawsuit abuse reform. It's just impossible to be with a straight face to say that you've got a bill that addresses the issue of health reform, health challenges in our nation, if you're not going to put in place some robust liability reform. So in the 2,000-page monstrosity that came through the House 10 or 11 days ago, there was really no attention paid to liability or lawsuit abuse reform. In our bill, we do some very specific things that we believe would significantly decrease the practice of defensive medicine, which is hundreds of billions of dollars every single year, hundreds of billions of dollars that can be saved through appropriate lawsuit abuse. Two things I'll mention specifically. One is a cap on non-economic damages, which has been promoted in the House and in many states, but is an important component of appropriate lawsuit abuse reform. And then secondly, we provide incentives for states to put in place health courts so that when a case is heard, that it's heard by individuals that have some fund of knowledge about what it means to practice medicine, what it means to take care of patients, what the challenges are, so that the folks who are hearing a case, determining whether or not there's merit, and then determining the award, in fact, have some fund of knowledge by which to make that decision. So we believe coverage is imperative for all Americans. We believe that insurance reform is appropriate and address that in a very robust way that allows individuals to select the insurance that they want, not the insurance that the government wants for them. We believe that the quality issue, the issues of who ought to be making medical decisions ought to be patients and families and doctors, and sadly that has to be written into law now. And we believe that the whole issue of lawsuit abuse reform has to be addressed. The good news is that you can do all of those things without raising taxes by a penny if you do them in a responsible way and appropriately decrease funding of the federal government elsewhere, so that we stay debate as a matter of American priorities that health reform is an appropriate thing to do. We gain the resources to be able to cover any costs in our bill through medical liability reform, through a number of different areas with gaining savings from the healthcare system, dish payments and the like, putting them appropriately into providing health coverage for folks, decreasing the cost of defensive medicine, but also decreasing spending in non-defense discretionary spending area by 1% every year over the next 10 years. Step down to 1% each year, which provides appropriate resources to a significant degree to cover any costs that might be encountered in the coverage of additional individuals through 3400. So that's kind of 3400 in a nutshell. I would draw folks' attention to a web memo that came out from the Heritage Foundation a week or so ago. For those of you online, it's heritagefoundation.org, and it's web memo number 2682, dated November 5th, that has a review of H.R. 3400. It's entitled Doing Healthcare Reform Right, the Empowering Patients First Act. So I would draw your attention to that. I think it's got some great points in an objective way evaluating our bill. So with that, I'm pleased to again be able to join you this morning, Dr. Burgess, and look forward to comments and questions here and online.
Very good. Thank you, Tom.